Hello, I'm Dr. Mark Norris, one of the adult congenital doctors here at the University of Michigan. I want to thank Dr. Joint, nurse practitioner Craven, nurse practitioner Stalder with the transition group for the chance to speak. I'm going to be speaking on the topic of travel. So let me work to share my screen here and we'll get started. Okay. So travel is something that I care about as a person and also as a cardiologist in helping prepare my patients for their travel. And the photo you see behind me is from one memorable trip to Kenya. And so I have some experience with international travel and travel to remote places and locations. So travel can be exciting, and I think I don't want to take that away. In fact, I want you to embrace the excitement of travel, but I know that it can be stressful, and I know that there can be barriers to taking on the challenges of travel in the setting of a medical issue. I believe that advanced preparation can reduce the stress of travel and maximize your enjoyment and growth and just really getting to know another place or another culture and enjoying the people that you're traveling with. Much of what follows on these slides are my personal observations and recommendations for you as an individual with your own specific heart condition, your own specific medications, or other medical issues. I really would encourage you to speak with your personal primary cardiologist and your primary care provider. I think that is at least the part of your team that will have insights for you. But that being said, let's go on to some general ideas and preparation. I would encourage you to know your medical condition. Think about these scenarios. If you are traveling and you have to go into an urgent care or an emergency department, and you are asked, what is the story with your heart? What is the story? I see that you have a scar on your chest, or I understand that you were born with a heart issue. Can you tell me about that? I would encourage you to have an answer prepared for that question. And if you don't know how to get to that answer, well, let's talk some more about that. Or even maybe a more stressful situation. You are traveling and you're told that you need urgent surgery to treat an injury or an illness that you have while traveling. What do you need to discuss with that team, if anything, before you receive that care? So I would encourage you to have that medical information available at hand and easily accessible. And I think about it in two groups. I think about the critical information that those treating providers are going to want in the first minutes of your care. And then I think about the more detailed information, the more comprehensive information that is likely included in your most recent cardiology clinic note. So that critical information would include your diagnosis. What is the name of your condition? Even if the team taking care of you isn't familiar with it, at least that's a starting point for them to start doing some searching and some reading to understand your heart condition. The next would be, is your blood pressure expected to be normal? Is your oxygen level expected to be normal? Or is normal for you something different? Or are you an individual where the blood pressure should only be taken on one arm because the other arm is not an accurate blood pressure? Is your oxygen level for you typically 85 or a what would be considered a more normal 95? So what is your baseline? If you can tell the emergency room doctor or the doctor in the urgent care when you're traveling, here's the name of my heart condition, but I know that I should have normal blood pressure and I should have oxygen level that's normally 85%. Well, that's a great start for where you and how you can be treated. The other question is, can you be treated like anyone else in an emergency setting? And for pretty much everybody, if it's an emergency, the answer is yes. You should have the confidence to say, if I need something emergently, I can go ahead with that. If it's going to be a life-saving procedure, even before the rest of the things that I would like to do, like connect my team to my cardiologist, if it is an emergency, can I proceed? And I'd like you to know the answer to that question, in part, in talking with your cardiologist. How can you have that medical information available? Well, a few options. One would be the electronic medical record portal if you're being seen here at the University of Michigan. That's through the myuofmhealth.org. And if you aren't active, there's some steps you can go through on that very website to get enrolled and to get access to your medical record. You can then share those records with another center. You can show them to them even on your phone, or that may allow you to fill in some of the answers to those critical questions on the last slide. You can take photos. If your provider has mailed you a letter and it came in the regular mail, you can take a picture of that letter. You can take a picture of your computer screen. If you're comfortable with that on your phone, as secure as your phone is or is not, that's one way to have your information available as well. Did you know that if your phone is locked and people don't know your passcode and you're not in a condition to give them that passcode, that if you have the information set up appropriately, any EMS or emergency room or other provider can get to your medical information through the lock screen or the emergency call screen. We'll look at that on the next slide and give you some guidance about that. And then lastly, some of our patients choose to use medical alert jewelry to convey some of this information, either the information on the jewelry piece itself or jewelry that directs people to a website where that information has been saved. All of these are good options. This is an example of a lock screen for an iPhone. It's an emergency call screen. It may be different on your current version of the software, but at the bottom corner, if you look down in the red text, at the very bottom, it says medical ID. And so even on this locked phone, the emergency call screen, this person has set up a medical ID set of information that gives their medical condition, their contacts, their emergency contacts, their medications, their allergies. They have taken time to set up the medical ID information so that anyone can access that in a crisis, even if they're not able to personally share the information. Well, how can you set it up? Here are two QR codes. The one on the left is for Apple, the other for Android phones. This should take you to the company website to set up the medical information. If these aren't working for you, you certainly can just search medical or emergency medical information in your phone for how to set that up. It's for both phones, it's on the locked screen. Even without a passcode, you can get to this information once it is set up. Well, let's say you have your trip planned and you know where you're heading. You can be proactive and look for the medical centers that are in that area. What would be the nearest medical center in the case of an urgent medical issue and the nearest one for an emergency medical issue? And you can do this not just in the US, but patients that I have taken care of, people have found these in many different countries and established what their plan is going to be, where they will go if they need medical care. In a life-threatening emergency, once again, I say proceed with care, meaning it's okay if you need to have an emergency procedure to have that team move forward without connecting. However, if you have even minutes or hours of time before an intervention is planned for you, there's time for you to educate your team and also to connect your local medical team, wherever you're traveling, whatever time zone or country you're in, to connect that team to the University of Michigan Adult Congenital Program. This is one of the great ways to do that is through the M line, a 1-800 number, an operator whose job it is to connect outside medical providers to Michigan medicine, cardiologists, and other providers. That number, 24/7, there is one of our team, could be me, could be one of my partners, ready to answer those calls. And we get calls from outside emergency rooms from other countries and provide the information and coaching as we can. And for example, sometimes what seems to be an emergent procedure as we talk about risks and benefits becomes only an urgent medical procedure, and things can slow down and we can educate the team. And how might we reduce risk then? That risk reduction may come through involving a different anesthesia team or deciding to do a medical transport to bring that person to our center or to a different large center with adult congenital care when deemed to be in their best interest. Sometimes it's just coaching the local team about your anatomy, physiology, and what to do differently or what to do the same as any other person. I would encourage you, if on the prior slide you were motivated to set up the emergency medical information, you could add this M-Line phone number as a provider to provider link, should you need that in the future. It's okay to seek care at centers that don't have adult congenital heart disease. But if you want to know in your area of travel, where are there centers that do have an adult congenital team like ours? The Adult Congenital Heart Association website has a clinic finder. And those clinics, the home-based clinics, are tied to a medical center in really all cases. And so the achaheart.org website is a trustworthy website that has a clinic finder link that can search by map or by state that you're going to, and you can see what's there. If you're planning to travel and you typically use medications, think about this from a packing standpoint. What will happen if you are separated from your medicine, if you're separated from your luggage? So think about whether your medication is in your checked bags or your carry-on bags. You need to have all prescription medicines and prescription bottles have documentation that that medicine is your medicine and not someone else's. You need to have your medical records with you, as we've already talked about, and carry-on is typically the safest way to go about this. Now you got to remember to get your carry-on and keep it with you. What about access to medications at your destination? Whether you lose your medicines, something happens to them, or if you're going to be at your destination for an extended period and you need refills, that's going to take some pre-planning. You're going to need to look at the country or destination and what the rules are about refills. It is wise to look at the country and make sure that the medications that you have are allowed in country, which is almost always true for cardiac medications. Think about customs, and as customs looks at those medicines, what they may ask you. Why do you take these medicines? Well, these medicines are my medicines, therefore my personal use. They're prescribed to me. They're in my prescription bottles, and I also have my medical documentation. Depending on where you're at, you may be in a spot where you need to refill medicine, and it may be a same family of medicine, but a different name of medicine, or a similar but different medication. And that's something that you and your cardiologist can work through. For example, the beta blocker that some patients are using here in the US may not be available in the country that you are then traveling in for an extended period, but you may be able to get something similar enough that your cardiologist is comfortable giving you guidance, or you may be there long enough that you need to establish a local medical provider who can team up with your primary cardiologist here back home to prep the medication change or to monitor the medication change for you. How about paying for all of this? Health insurance. Review your insurance policy information for travel. And if you don't know, but you have your medical card, there should be a toll-free number or a website you can go to look at what your policy says about getting medical care out of network, out of state, out of country. What is the coverage like for that? Emergency care is addressed in almost all insurance policies. Take your insurance information with you. That may be taking a picture of your insurance card. You may choose to take the card itself, but make sure you have your insurance information, including a contact phone number for your insurance provider. There are some scenarios that come up that you may not have anticipated for local domestic travel, but may arise, especially in less resourced destinations. And that may give you reason to look into global health evacuation insurance. This evacuation insurance is different than health insurance. This isn't asking for assistance with paying for your medical care that you would get in country. This is about insurance to cover the cost of having an air ambulance come from the US and take you to a country that has the resources you need, potentially all the way back to the United States. This is something for me that came into play during my time in Kenya and Central America. The cost of that is very high. You can imagine potentially multiple pilots, nurses that are equipped at an ICU level of nursing experience, the medical equipment that's on the flight, the fuel, uh, potentially the crew may have to stay in the country of destination and sleep before they head back the other direction. So, a lot of cost for that kind of technology and resource to be put into play. It may cost hundreds of thousands of dollars. Global evacuation insurance is on the order of dollars or tens of dollars per day, not hundreds of dollars. And so this is something that is typically affordable, especially for a shorter trip, and is offered through a number of different companies as global evacuation insurance. I'd recommend that you look through those policies carefully as you're picking between them. All of this preparation, hopefully this preparation is decreasing your stress and not increasing it. But finally, you make it to the Detroit airport where this photo is taken, or the airport close to where you are, and you're ready to go on your trip. You've got your medical records, you have your medications, you have your ID, your passport, you are ready to go. And then you walk up to the security checkpoint. And as you're walking up, you start to wonder, well, I see that there are regular metal detector kind of gateways, but then there's also the full body scanner where the scanning gantry swings around you. Where are they going to send me? And is that okay for me? If you have a medical device, such as a pacemaker or ICD, I would encourage you to notify the TSA, the security folks who are working to get you through the checkpoint safely. You can notify them, but I want you to take and be confident in the fact that all screening options are acceptable. So the TSA will guide you through what they think of as the best option, but I do not have an option that I am worried about for you as far as harming you or harming the device. I say that based on looking through device manufacturer guidance as well as some research studies. Certainly, you can talk to your own pacemaker team and see if they have a preference for you individually, but in general, all options are acceptable options. Well, what if you don't have an ICD or pacemaker, but as you walk up, you remember that at the time of your surgery, you had sternal wires placed, or you've had a heart catheterization with a plug or a coil or a closure device, and you start thinking, boy, are those going to be affected in a negative way by these different screening modalities? Am I going to set off the metal detector? Is this going to be a problem? All of those are okay and are very unlikely to set off a metal detector or to be a problem in the full body scanner. So, from a safety standpoint, all options are on the table. If there is a question as you go through the metal detector, or if they say, well, just step over here and we're just going to pass the wand across you and across your medical device, that's also okay. There is very, very low risk of any harm, especially if they continue to have the wand in motion. They'd really have to have the wand right on top of the pacemaker or ICD for an extended period before there would be any chance of temporarily changing what's happening with your device, and with really no risk of long-term change or damage to your device. So if you put a strong magnet over the pacemaker or ICD, what bad thing could happen as you think about being prepared for travel? And really, the question is just, will the device temporarily go into a different mode, which should also be a safe mode? And then once the magnet is removed, the device should go back to normal function, normal operation. Excuse me. All right, you made it through security. Congratulations, you're on the plane. And now you're thinking about safety on the plane. What about flying in oxygen? If your baseline oxygen level is normal and you do not typically use oxygen, or your baseline oxygen level is below normal, but you do not typically use oxygen, you are expected to do well on an airplane without oxygen. If, however, at your normal baseline and your normal day-to-day life, you use oxygen, you should plan ahead. All of the airlines have ways to put it into place, oxygen for you to use or to bring with you for the airplane. That will take some pre-planning and some documentation between you and the airline and potentially a form that your provider will need to work on with you. Otherwise, expect to do well without supplemental oxygen. The planes are pressurized to about 5,000 to 8,000 feet above sea level equivalent. So even if your plane is at 35,000 feet, the cabin is pressurized as if you were in approximately Denver, Colorado. The air may be a little thinner, the oxygen may be not quite as abundant, but I do not expect you to have a significant change in your oxygen saturation or how you're feeling. You may feel like when you're up and around that you feel like you're breathing a little bit harder, but should not have any significant change. Well, what if you do feel worse? What if something happens on the plane? All commercial flights have medical kits, and the FAA mandates medical supplies, including oxygen, be available on all commercial flights. So if you really are feeling much worse and are having a hard time breathing, you should notify the folks there in the plane, and they should be able to provide you with oxygen if that is what you need. But again, if you don't need oxygen in your day-to-day life, I wouldn't expect you to need it in Denver, Colorado, or on that airplane, regardless of the altitude that the plane is flying. Okay, some things you're proactive, some things you can do to minimize your risk even more. Blood clot prevention, stasis, staying still, can promote blood clots. So movement is your defense. Dehydration can promote blood clots. So hydration is your defense. If you're on a fluid restriction and are being very careful about not getting too much fluid in your body, pay attention to that. I'm not asking you to disregard those recommendations from your providers, but movement and adequate hydration will help prevent blood clots. If you're allowed on long flights, like international flights, and the safety seatbelt sign is off, go ahead and do brief walks. Get those legs stretched out and moving about every hour. I don't have great data for that, but that would be my general recommendation. If there's turbulence and the seatbelt sign is on, then you can flex your legs and move them. Work those calf muscles, push with your legs, get those leg muscles pumping some of that blood that's in the veins in the leg, getting it back into circulation. You can do that every 30 or 60 minutes. I think that that is going to reduce your risk of blood clot. What about destination specific factors? What if you're going to a place that is higher in elevation? Um, for folks that have low oxygen levels at baseline and those with single ventricle Fontan anatomy and physiology, you may feel worse at high altitude. Your defense plan should be in place for what to do if you're at high altitude and you feel bad, you're having a harder time breathing, you feel like you are not clear thinking. The initial plan should be a plan that you can get to a lower altitude, usually even a few thousand feet lower will improve your symptoms. And that plan should not be you driving. That should be a plan of somebody else driving you to a lower elevation and thinking about what's your plan for dropping in altitude. And then if things still aren't better, where can you get medical help? Um, if symptoms of shortness of breath have developed, worsening cyanosis, which is that blue appearance, don't just say, I'm going to go to sleep and see if I feel better in the morning. It really is time to get lower in altitude. A little bit more shorter breath, sure. When you're up and moving, feeling like you're having to breathe harder, okay. But shorter breath, even just when you're trying to be quiet and rest, is not what I would expect. So consider dropping in altitude and thinking about that versus supplemental oxygen. If your medical center that you're going to access is also at high altitude, they may just supplement oxygen for you to give you some relief. For those who are heading to water sports, diving and snorkeling, in general, my overall advice to people is that they avoid water activities where they're alone, that they would be doing activities where other people are with them. And that's irregardless of heart issues or not. I would think about snorkeling as something that may be low intensity or may be high intensity. It depends on the water conditions, the waves, the wind, the current. Snorkeling may be a fairly rigorous activity, or it may be a nice relaxed float. It really depends. And so I would talk to the leader of those trips to see what it is going to be like for you physically and what your plan will be if you feel like you're tiring out. How do you get to a place of rest and out of the water? respiratory physiology, oxygen level, all of that is normal with snorkeling. And so I don't have anyone that I would say absolutely not. Scuba diving is a physically strenuous activity in most places. There's temperature changes, there's muscle use, there's change in respiration using a tank with your oxygen being supplied. There are a lot of swings in your unconscious or autonomic nervous system. So your body really is going through quite a few different changes in the midst of scuba diving. It is kind of a next level. It is more intense activity than just snorkeling. It can unmask arrhythmias. So if you are somebody who is having arrhythmia issues, you need to be thinking about that and what risk you want to take, as it may be unmasked by this diving experience. Um, I would recommend for folks with heart issues that if they choose to scuba dive, that they dive only to depths where they have an option for immediate surfacing. That's usually 10 meters, 30 feet. It would be considered a low risk for rapid rise to the surface. There's a very low risk for any gas bubbles forming, or what's referred to as the bends. Dives that go deeper, where when you're coming back up, you have to take pauses to let any gas bubbles in the blood go back into the circulation and re-enter the bloodstream. Those are an increased risk. And so if something bad is happening and you surface from 60 feet underwater all the way to the surface because you're having a new arrhythmia, that may cause problems with these gas bubbles and the bends and can do a lot of harm. So immediate surfacing depths, 30 feet and shallower. There's some variation on the recommendations, but that would be a low risk type of dive from an immediate surfacing standpoint. I recommend always doing buddy dives. Low threshold to surface if something seems off for you, and your buddy knowing that you're surfacing it and the buddy surfacing with you. And I'd encourage you to talk to your cardiologist about this, especially if you're pondering doing deeper dives that do require decompression stops. Remote locations, even someone going up into the boundary waters in northern Minnesota back in a canoe trip, you may be several days from being able to access a cell phone signal or medical help. So think about some of these newer GPS satellite communications. These are available for rent from certain companies. And then the price of these units has come down tremendously. So you can at least text over a satellite and put out an emergency distress locator beacon. Those really have come into the mainstream now. If you have a pacemaker ICD and you're going for an extended period, think about whether you need to take your hardware or the means that you give your device updates to your local team, maybe your phone or separate equipment. Generally, it's not recommended that you send any updates or that you pack extra equipment if you're going to be gone for a month or less, unless you're at a period of lower battery. So I would be paying attention to that. And know that most pacemaker devices are common across different countries. And so the country you're going to, if they have medical centers that deal with pacemakers, they probably can assist with your type of device. Illness prevention and treatment, and we'll kind of wrap things up here in just a minute. Traveler's diarrhea. This is a foodborne illness that you can get from water or food sources. Often it's recommended if you're going to countries where this is common that you take antibiotics with you in case this happens to shorten the duration of your illness. The best thing you can do is avoid it. And so careful water and food precautions, thinking about where that may sneak in and knowing where your food is coming from. One of the classics is you're being really careful not drinking the local water, but you take a drink at a restaurant and they have ice in it and it's their local water that, although frozen, actually is contaminated. And so you have gotten contaminated water through the ice. So think about ways to avoid some of those means of getting the bacteria to get sick. The commonly used antibiotics for traveler's diarrhea can prolong the recharge time of the heart, called the QT interval, can be a prolonged QT interval risk. And so it's not wrong to prepare with those medications, but I would talk to your cardiologist about the situations where you would or would not use those antibiotics, or talk to your cardiologist before you fill that prescription to see if that's something that would be reasonable to you, because most of the time, you will get better from these illnesses. The antibiotics just make it shorter duration and get you back into your enjoying your trip a little bit sooner. If you're going somewhere that has malaria, there are a number of different malaria prophylaxis or prevention medications. Which medication is recommended or your option depends on where you're traveling and what type of malaria is in that area. I just say discuss that with your cardiologist because there are potentially some effects of those medicines. Generally, for most people with a heart condition, we will be able to find a malaria medication that is acceptable. And if you're not sure, again, talk to your cardiologist and do it with enough lead time that people really can put some thought into how to do that. Where you're going, you may have vaccination requirements. There's some countries where you cannot travel without a yellow fever vaccine. Countries where meningococcus, meningitis preventing vaccine is recommended. These will almost always be approved by your cardiologist. It is possible that as your body responds to those vaccines and produces antibody to protect you in the future, that you can have systemic inflammation, fevers, and those inflammatory processes may unmask an abnormal heart rhythm. Uh, I would not say that they cause an abnormal heart rhythm, but if you are prone to it, that inflammation can be enough to unmask that type of a rhythm. And these vaccines should be considered well ahead of your travel date, both to arrange them to find a clinic that has the proper vaccine and to get your immune response completed before you go, which can be a minimum of 1 to 2 weeks for most of these. With that, you've had lots of preparation. I hope that you're not discouraged from traveling by this and by the things that we're talking about, things that could happen. I really think that your best approach is to think about these things, to come up with an action plan, to carry your umbrella, and then hopefully and likely you will not need it. But if you do need help while you're traveling, if you do need medical help, at least now you're more prepared. And you know that your medical team here, your adult congenital team at the University of Michigan, is ready to engage with whatever is going on wherever you are. We're here to help with that, even in an emergency situation. So I hope that you have great travels ahead, and please do reach out with questions. So I'll leave this talk here for now, and I appreciate your attention to this.